Hello, ladies and gentlemen. Welcome to Cardiology Rotations Manual. I am Dr. Nik Nikam. In this presentation, we are going to be looking at the most important part of managing a patient with decompensated heart failure. If someone comes through the emergency room, or if you're seeing someone in a consult for decompensated heart failure, I'll tell you the history is the most important thing, and we're going to go through all the different points that we need to cover in order to arrive at a proper diagnosis as what is causing the heart failure, what is causing the decompensation, and how we can rectify those problems. So stay tuned till the end of this presentation. I will tell you how to get a free copy of my Cardiology Rotations Manual. So let's get to the table of contents and begin with our main feature presentation. And the beauty of this is if you just control click, it will take you right to the topic. So whenever you see a patient with decompensated heart failure, these are some of the important things you need to focus on. First, what is the cause of decompensation? Is the patient taking all the medicines? Has the patient had a change in weight? Weight is an important barometer as to whether the patient is retaining fluids or whether the patient is having any other issues. Has the patient changed the diet? Has the patient been taking too much salt? New symptoms are exceedingly important. Chest pain, shortness of breath, fatigue, edema, and all these things are important. And the onset of these symptoms are also important. Did this come on suddenly, the shortness of breath, which may suggest something acute versus progressively getting worse? Same thing with leg swelling. Has it been gradually getting worse, or did it just come on quickly? You may not have any leg swelling in patients with diastolic heart failure. Infection is an important thing we need to exclude. Did the patient have like a flu, upper respiratory infection, or any history of kidney infection? Those things can precipitate heart failure. Worsening of renal condition. Does this patient have renal failure? What was the last creatinine? And review of this chart will get you almost from the time anything that started to the point where we are before this consultation. So review of the chart and getting all their medications, their diagnosis, their tests, and all the things that are related to their heart failure, their left ventricular function, the last echocardiogram, the last heart catheterization, the last angiogram, all these things are important to come to a conclusion as what is causing the decompensation and how do we address that. We also look at their entire medication list, look at the doses. Are they taking the proper doses, or are they skipping the medications? And palpitations. If the patient has a history of sinus rhythm, and if they develop palpitations, did this patient develop this rapidly, or did this come on gradually? A gradual onset may just suggest worsening of heart failure, versus a rapid onset may suggest like onset of atrial fibrillation with rapid ventricular response, or a rapid ventricular response in a patient with a pre-existing atrial fibrillation. Is the blood pressure out of control? Have there been any changes in the non-cardiac medications? It is important to follow all cardiac medicines, but it is more important to follow non-cardiac medications. So we see if they have any interactions with cardiac medicines to make the heart failure worse. Has there been any blood loss? In patients with kidney problem, we need to be concerned about their dialysis situation. When was the last time the patient had dialysis? And how often does the patient have dialysis? What is the baseline weight? Did the patient have any regular heart rhythm, which I talked about? Does this patient have, is this patient taking medications for regular or irregular heart rhythm? And the most important thing is, what kind of underlying heart disease does this patient have? Does this patient have coronary artery disease? Does this patient have hypertrophic cardiomyopathy? Or does this patient have dilated cardiomyopathy? So basically we have to establish, does this patient have a systolic heart failure, congestive systolic heart failure with dilated flappy heart? Or does this patient have a hypertrophic cardiomyopathy with a small left ventricular cavity which can lead to acute pulmonary edema in a very short order with just excess volume or salt intake? Or does this patient have coronary artery disease where the symptoms may come and go? Does this patient have a defibrillator? What was the last ejection fraction? What was the right heart function? Does this patient have pulmonary hypertension? You can get all this information from their echocardiogram, from their records, because most of us deal with electronic health records. So I would scan through the entire electronic health records and look at what are all the conditions that this patient has in addition to the heart failure. So we can put all the pieces of the puzzle together and come up with a composite idea as to what caused the decompensation. Did the patient have heart surgery? Did the patient have coronary artery bypass surgery? Does the patient have valvular heart disease? Does the patient have coronary stents? When was the last time the patient had a coronary stent? How many stents the patient has? What was the last time the patient had a stress test or an echocardiogram to look at any evidence of reversible ischemia? How many heart attacks did this patient have? When you put all this history together, which constitute almost 80% of evaluating a patient with heart failure, especially a decompensated heart failure, then you have a pretty good idea as what really brought this patient to the hospital to begin with. Was it an ongoing myocardial ischemia? Was this the medications? Was this related to diet? Was this related to infection? Was this related to an arrhythmia precipitating the heart failure? Was there something else outside the heart? And then only you will be able to order appropriate tests in terms of echocardiogram or a nuclear stress test to look for any evidence of reversible ischemia, and then proceed with the treatment. I hope this quick synopsis of history taking in a patient with decompensated heart failure will get you more focused on how to find out what caused the decompensation and what you need to do next. Thank you so much for watching this presentation. Okay, if you would like to get a free copy of this cardiology manual, which is almost 140 pages of very useful information, send us an email to drniknikam at gmail.com. Let me see. Here's drniknikam at gmail.com, and you'll get a free copy of this one. Also, we have more than 160 to 170 cardiology lectures on our YouTube channel. You're welcome to watch those. Doesn't cost you anything. You may learn a point or two, and I will see you next time.